The sudden arrival of the COVID-19 pandemic shocked us, and we buried our fears and hopes in the names we called it. Rich people's disease, a virus for those who could afford international travel, the disease of cities. We thought, for a change, here is a pandemic that's not out to get the poor, to kill rural populations, or stigmatize developing countries. But before our singing was done, we had to rewrite our songs. The coronavirus did not segregate. The poor and vulnerable suffer too, from infections, from the socio-economic impacts of the pandemic, and from lockdown regulations. Rural livelihoods and communities in Africa are generally fragile. They are highly vulnerable to the impacts of disasters and other shocks. Problems rooted in coloniality, apartheid, and bad governance continue to rear their ugly heads, manifesting in inequalities, bad roads and transport systems, and poorly resourced local governance institutions, amongst other things. These have been worsened by climate change, droughts, and prolonged dry seasons that destroy pasture and crops, heavy rains that wash away bridges, and tornadoes that blow off rooftops, damaging infrastructure of homes, schools, and clinics. COVID 19 joins a string of unfortunate conditions eating away livelihoods and well being in rural communities. At the Sachi Chair in Sustainable Local Livelihoods, we have been journeying with our local partners and the communities where we work. We have listened to many stories on the pandemic's impact on rural well being. The largely informal economy and subsistence businesses of rural communities could not resist the disturbance of the pandemic, adapt, or easily bounce back after the initial impact. During hard lockdowns, petty traders could not earn. Hairdressers had to stay at home for weeks. Local beer brewers could not sell. Food insecurity heightened as the scarcity of livestock feed and the struggle to recover land based livelihood activities already affected by droughts worsened. We heard how Lungisani and his family survived on selling wormwood after his business crashed during the pandemic. The claims in Madagascar that this indigenous remedy for colds, flu, and stomach ailments could also cure COVID 19 did not only draw further attention to the potential missed opportunities in often neglected indigenous systems, it also offered a hook for rural economies to hang on as society adapts, recovers, and rebuilds. We heard from traditional authorities and practitioners about how local wisdom and indigenous knowledge have been overlooked by policymakers, even in times of crisis. Traditional authorities were not involved in decisions and implementations of regulations despite their proximity and influence in their communities. Community and youth empowerment programs came to a standstill, in some cases, undermining previously achieved milestones. The leaders of these interventions struggled with new working conditions, rethought strategies, and strove to assure funders that they were still relevant and worthy of their money. The widespread lack of adequate skills and education to develop local economies and provide communities with options and resilience when disasters like COVID 19 strike has been a major stumbling block. Rural communities depend on social ties such as kinship, faith-based networks, Stockwells, and other networks as part of their collective of sources for holistic support. The pandemic disrupted these connections, but also revealed their ability to adapt and meaningfully exist in the lives of community members. Churches, civic structures, and traditional leaders provided needed relief and assisted in identifying the most vulnerable households to ensure a fair distribution of support. We also heard about the efforts municipalities made to supply households with water and to communicate important information to communities despite infrastructural difficulties. Yet, they left a lot more undone. The pandemic shook us. We are adjusting. We are learning and becoming wiser. How does this wisdom translate into stronger institutions and more effective interventions for improved well being of rural communities? That remains the question.